Hi there. This is Lisa from Meridian Care Center, and as you can see, I'm on day 8 post-op from massive rotator cuff surgery and bicep tendonitis and labral reconstruction. So, pretty significant surgery. I went over, my story in a previous video that you can check out if you're interested. But I just wanted to post a video here for people who may be in a similar situation. Before my surgery, I did lots and lots of research because I live alone in the middle of the forest, and I knew that I wasn't going to be able to drive for a long time, but also I'm a natural health practitioner. So I have 25 years of kind of experience and research and knowledge that has helped me be more prepared for this, but also to kind of understand, what the best way forward is, because I don't really want to waste money on things that aren't that helpful. But I also know by reading the statistics that individuals over 45 years old, especially with previous shoulder injuries and other issues like thyroid and cervical spinal concerns, are at the highest risk of re-tear. So the last thing I want is to have to go through this again, because it kind of sucks. So anyways, I'm just going to share with you, like I said, I'm only just a week out of my surgeries, so but this is all the stuff that I got to prepare myself for surgery and the tools that I have been using. So 1 week, on day 7, I started to work again, and I have my pain medication down to 1 Tylenol and 1 Advil during the day. And then I'm still taking the um, pills they gave me to sleep, because I know sleeping is such an important part of the healing process. But during the day, I'm managing with all these little tools. So I'm going to show you my big pile of stuff. You can see the light change there as I went in the window. So I'll start off by telling you one of the first things that I did to prepare that is I chopped all my hair off. And I actually got like some highlights too, because I knew that I wasn't going to be going to the hairdresser for a few months. And already, like, I was 3 months living with this tear. So I'm just going to shut this off here. Living with this tear. So I already knew what my restrictions were, and doing my hair, washing my hair was a big challenge. So I cut off all my hair, just a plain little, kind of semi-short haircut, and that was just amazing. And then I'm just going to show you quickly my treasure trove of tools. So to prepare for surgery, like I said, cut off all my hair. I did a whole bunch of cooking. So I prepared a whole bunch of meals and I froze them. I also purchased like pre-made soups that had like snap lids on them so that I could get them open for a quick meal. Shredded cheese, which I'd never, ever, ever get, instead of having to slice my own cheese. And in terms of the support that I'm getting, I need people to drive me around, to do grocery shopping for me, to peel and cut fruit and vegetables, because that just doesn't work. And rides to physiotherapy. So I've got most of that set up. I also needed help for caring for my horses for some time, but that's maybe a little outside of this. So the other thing that I did pre-surgery is I started to use some PEMF treatment. So I was using this all the way through since my injury. I have a Medicrystal 4-stone gemstone PEMF infrared and negative ion mat. That is wonderful, and it's really good for reducing pain. I don't have it here with me now because it weighs about 35 pounds. So once I got my friend to position that for me on my massage table, I'm not moving it again. So right now I'm actually staying with my sister because I live in the country, like I said, and it was just going to be really difficult for me to get the support that I needed there. Plus, my surgeon is 2.5 hours away from where I live, whereas where I am now, it's only 1 hour away. So I got that sorted out. And then the other thing before surgery that I started to do was Beamer. So I don't know if you've heard of that, but it's also PEMF, which stands for pulsated electromagnetic frequency. And the Beamer, the good things about the Beamer are it actually uses PEMF to deliver frequencies to the body, so it's a little bit different than a regular PEMF mat. So if you have questions about any of that, you can leave it in the comments. And the other good things about Beamer is it's very portable. So it's very lightweight. It goes into a bag. I could pick it up and bring it here with me. I can move it around. Right now it's in the recliner, which is something that is really, really helpful to have. And also that it has a cuff. So it has just a cuff that you can put on for localized treatments right on your area of injury. So I was told not to use that in the first week because apparently it works so well that your stitches can heal over and then they're really difficult and painful to remove. So they said after 1 week, start to use it and then it'll increase the healing but not too much so that you can still get your stitches out. So I've been doing PEMF. The other thing that I was doing ever since the accident and continue to do, you can see my incisions here. You can see these little stickers. These are a Life Wave infrared patches. And they have a number of different patches. Depending on your health situation, different patches work differently for different people. So for me, I have been using the X39, which helps the body stimulate stem cells. And I was using those. I had a previous dissected vertebral artery, so I was using those as well as the Eon patches. I'll show you those in a second. Um, for my headaches and migraines and whatnot since 3 years. And I had a CT scan on that just about a month or a month and a half before my surgery because they were concerned about vascularity before I was traveling, but also before my surgery. And it turns out that the vertebral artery, which they said if it hadn't healed within 6 months, that I would live with that for the rest of my life. Well, just over a year ago, I started to feel really good and started to feel a little bit back to normal, although I would say the brain injury was still affecting my cognition and memory. The pain in my body had reduced significantly. It healed. And I wasn't doing really anything else except my PEMF, my Medicrystal PEMF mat, and these LifeWave infrared patches. So if you want to ask me if these things work, I mean, there is research on them as well. But personally, I healed an incurable illness. So I'm going to say, yeah, they work. They work really well. So let me just get down. It's a little bit difficult to do this because I only have one arm and I'm holding my phone. I do have a place to prop my phone. And so I'm just going to come down here a little bit. And you can see my little pile of stuff. But I'm going to just show you. So unfortunately the camera is backwards. But those are the X39, the Eon patch, And then the X49 helps the body create connective tissue. And then there's one more patch that I use, which I didn't bring over here, and it's called glutathione. So again, it doesn't have glutathione. None of them have these substances in the patch. They stimulate the body to produce these chemicals. And so recently I've seen some research coming out about Tylenol, that it depletes the body's glutathione supply. And glutathione is one of the major players in detoxifying the body, particularly from heavy metals. So our society is riddled with heavy metals now. So it's a really, really important supplement to take. And I'm just going to put my phone up here. There we go. I think that's pretty good. And so that brings me to the other, this is called NeutraSwish, and that is also for glutathione. It dissolves under the tongue, so it's a much more absorbable form of glutathione for the body. So I've been taking that as well, because I really, especially in the first week, I was taking a lot of Tylenol. And I took a lot of Tylenol after my previous injury, so I figure I'm probably, it's probably good for me to take. So the next thing that I'm going to show you, since I'm kind of on the energy medicine part of the video, is my, so this is a red light therapy cuff. So this is by Infrared. So again, there's lots of research out there that shows that red light therapy not only reduces pain and inflammation, but it speeds up the healing process. So the way I see it, I'm taking, I'm an acupuncturist, shiatsu therapist, I practice osteopathy, and I can't work right now, and I can't work for months. So anything that I can do to get my body back into shape so I can be back to work, it's gonna be helpful. So I'm all in on getting this healing process working as well as I possibly can. So those are the kind of energy medicine pieces. And then I'm going to show you some of the supplements as well that I have been taking. So I'll start out. So I started out with probiotics. Again, partially because of all the medications that I'm taking, but also, as you probably know, pain medicine has a tendency to constipate. So that's partially to keep my bowel moving really well, and to keep my gut health optimized as much as possible. And so the other thing that I'm doing for pain is I'm eating these gummies. So these are, it's 15 milligrams of cannabis, and I just went into the local dispensary and asked them which one would be the best one for pain, because I know nothing about these things, and they work really well. And because they're specially designed for pain, they don't have any side effects. Like, I don't feel, I mean, I wouldn't drive, but I don't feel particularly loopy or anything like that. And the other thing I started taking right after, before actually, and after surgery, is arnica. So I'm still taking that, and I will probably continue until the bottle's gone, because that's kind of how I take supplements. So I took a whole bunch just before and just after the surgery to help with the tissue regeneration. And then the other important one on that side of things is curcumin. So turmeric or curcumin is very, very good for inflammation. It helps to clean the blood. And it's also, yeah, those are the main things for curcumin. So it kind of cleans out, flushes the blood, and reduces inflammation in the body. So curcumin. And people say, oh, well, why don't you just take turmeric? You can't take enough turmeric. You would turn orange before you got enough turmeric, loose turmeric in your body to make a difference. And these do take some time to kick in. So again, if you're going to do curcumin, start taking it way before your surgery. So it's like a month that it takes for curcumin to really start having an impact on your body. And the other supplement, the last supplement that I have here, I also have Noon tablets over here. I'm sure you guys have seen it. Is something for hydration. So again, you know, because of all the meds and everything else, I just want to make sure that I'm really hydrated so my tissues have their best chance for healing. So then I have this. This is like a Chinese formulation. It's like a pain oil. So I massage this on the area, although a lot of the time I have patches on, so I can't really use it. But it's kind of stinky. But in a, oh, this smells like good medicine kind of way. But it works really well for pain, local pain, back pain, whatnot. And the other kind of wellness thing that I have been doing is castor oil. So I started doing castor oil packs on my abdomen about 2 weeks before my surgery. And I partially did it to clear my liver, right? To clean up my liver, to pull out any toxins in my body. So I'm kind of getting a fresh start with all of that. But also, like, the liver delivers pain signals to the body. So if your liver's working well, then you're going to feel less pain. And the other thing is what happened with me and what happens with a lot of people is you clean out your digestive system really well. So I am a person who can struggle sometimes with constipation. So castor oil packs really helps my system, my peristalsis start working really well so that I don't have as much problem with that. So I did it for a couple of weeks before surgery, and now I've taken a pause for the first week because I was taking a lot of pain medication. I didn't want to um, make anything worse. So I'm waiting a week. So I'll start doing my castor oil packs again, probably today or tomorrow, and start flushing out all of the chemicals that I've put into my body. And you can see the bags here. This is not from a lack of sleep. I'm actually sleeping great, and I'll talk about that in a minute. But it's the crap, right? It's the Tylenol, it's the morphine, it's the pain blocker, nerve blockers, and you know, all of the stuff that I put in my body that my body is not used to and doesn't really like very much. So the other tool for the injury, and this was really, the surgeon told me to get this. So this is it's called the brand is Aircast, and this is a cryo cuff. So you put this cryo cuff on the shoulder, and then you'll see behind me here is a thermos which gets filled with cold water and ice water, and then you run that. And I've been doing 20 minutes on, and then it's usually longer than 20 minutes off, but you know, up to an hour off, then 20 minutes on, 20 minutes off. So yes, to answer your question, I haven't been sitting around doing nothing like people think. I've been taking care of my wellness. It's cryo cuff, and then I'll do an infrared session, and then a little while later, you know, cryo cuff goes back on, and then I'll do a beamer session, and then the cryo cuff goes back on. So it's really quite busy. But I'll just take a little pause there on the everything that I'm using. I feel pretty good. My pain is pretty low. 2 nights ago was the first night I slept all the way through the night without waking up and having to take pain meds in the night. So yesterday morning I woke up and I was in some pain. I definitely knew that I had incisions on my shoulder, but I took a Tylenol and an Advil, and I was fine, and I was fine during the day. And then this morning, so it's about a 4, I would say, not this morning, but yesterday morning when I woke up, and then this morning, having only taken pain medication at like 10 o'clock at night, I woke up this morning and I was probably without any meds at 2. So that's great. So today maybe a 3. I did take Tylenol in the morning, and then probably during the day today, I may just try to take a little bit of gummy bear for pain and see if that can get me through to bedtime. And if it can't, then I'll take another Tylenol. But I'm going to continue to take the medication at night for sleeping because sleep is important. So before we go into sleep, the other tools, definitely get yourself whatever version of these flossing picks or strings that you can. You will not be able to floss your teeth. Much to my chagrin, I bought an electric toothbrush. I just got a cheapo one that's battery operated. I didn't buy an expensive one. I'm spending all my money on my wellness. I really didn't want to, but I just am hearing stories about 55-year-old women re-tearing their rotator cuff brushing their teeth. So I'm not that person. And the other thing that has been really helpful, and here we get into the downs and dirties, is a portable bidet. So this is great. You just fill it up with water. It's got an adjustable head on it. It was about $30. And you put warm water in it and you rinse yourself off after you go to the bathroom. Particularly if you're right-handed like me and it's your right shoulder, this is super helpful for cleaning you up. And one of these on a long stick. And whether you get a scrunchie or whether you get an exfoliating brush or whatever it is, very important to have something to wash your body. And you're going to want all of your bath supplies, soap, a shampoo, conditioner on a pump. Because getting, stuff out of a bottle and into your hand and onto your head is a little bit of a logistic nightmare. So definitely have one of those. Have I forgotten anything? Oh yes, pillows and pillows and pillows and pillows. So if you don't have a lot of pillows, do yourself a favor. Big Borrow Steel, buy lots of pillows. I love down pillows myself because they kind of squish to your body. I had different people say that they slept in their reclining chair for a period of time, some people up to a month. I slept in the bed even from the first night with the Wedge. So I'll show you the Wedge here. So this is my Wedge. And it's been great. And so I put that on the bed, and then I have a series of pillows. The first night it took me, an hour and a half to 2 hours to figure out how I was going to sleep and how I was going to get comfortable. And then, Jesus. After that, I had it pretty much figured out. So after that, I could just kind of go back. And of course, my personal support pet has been amazing here. But after that, I could pretty much put it back to how it was and adjust it a little bit. A few times during the night, I have to adjust my sling, and I have a pillow that goes right under my arm here because the arm actually has to stay in front of the shoulder. So that's something that, again, it takes a little bit of work and practice. But for me, it may be different for other people, but for me, 1 week in, and I pretty much have that part figured out. So, but the recliner has been really, really good because what I found, even by the second day, being up and about and doing things that even just being upright, that pulling on the shoulder is just, it hurt. Like it's like I could feel the ripping. So not a good feeling to have. And again, because I've done the research, I know people over 45, 10% of them have retorn within the first 2 weeks. And the first 6 weeks is like 30 or 40%. And then 3 months of all the re-tears, like 90% of re-tears happen within the first 3 months. So those are the kind of statistics that I'm not interested in engaging in. My plan was to go south at the 6-week point and get in a pool and do lots of my rehab in the swimming pool in a warm climate where I don't have to carry wood, et cetera, et cetera. But I have an appointment on Monday with my surgeon, and I think I'm probably going to rethink that and go after the 3-month point so that I'm past the kind of most dangerous time, because for anyone who travels, you know that people in airports it can be very busy and crowded, and I just don't need to be knocked around at this point. That would just be a horrible way to end up re-tearing. I really didn't need to fall on the floor either, but again, I've been, you know, practicing that kind of stuff a little bit, and so I just kind of fell really naturally. There was actually a little tug on my shoulder I can feel, but it's very, very mild. Oh, so the other thing, finally, this should have gone in earlier, but the other thing that I would say, if you're preparing for shoulder surgery, is you may not realize how much you use your shoulder for strength and balance. And that was a real wake-up call for me. So, one of the things that I did is I really got to work on my legs and core strength. So I started to do, because I was trying to do qigong, but I really couldn't do much with my arm. I had no movement in my arm. I couldn't do anything with my arm. I also did strengthening stuff for my left arm and shoulder before the surgery. But one of the big things that I was doing, and maybe one of these days when I'm not wearing a dress, I will get on and I'll show you the preparation exercises that I did before my surgery to help strengthen my legs and my core. But basically, I would standing up and I would lower myself to the ground, bring my legs out to the side, roll around to the other side, and get back up again without using my arms at all. And then I would do that the other way. So what I'm doing there is I'm working all the rotational muscles in my hips and my legs and my back and my core, and just getting used to not putting my arm down. And so I would do that sets of 10, 2 to 3 times a day. And it's quite incredible how quickly you build muscle. So, there's lots that you can do to prepare for the surgery. And again, it really depends. If someone is younger and more athletic, some of this stuff might not be as relevant as someone who is a little bit older. Um, someone who's less active, less physical, less fit. I would say for a person my age, I'm relatively fit. I used to do canoeing and kayaking and skiing, and my property is on a big slope, so I'm always getting kind of lots of exercise just existing every day. But that really went down because I became also so much less active after the injury. So do yourself a favor and really prepare yourself for this surgery so that you can come out of it with the best possible results and raise those statistics so that we don't have such a high incidence. If you start doing the research, you'll see that I think it's over 40 was the research I looked, but 50% of people with a greater than 3 centimeter, oh gosh, now I forgot what it's called, the tear, where it's moved away from the joint, don't have aren't successful surgeries. So, I mean, you still have a 50% chance of having a useful shoulder again. But I believe that the better prepared you are, the greater your chances are that you're going to have successful repair. And as I'm learning more and more, the older you are, the slower that you need to take the rehabilitation process as well, because more aggressive rehabilitation on older people tends to lead to more re-tearing. So we have to just relax, chillax in our easy chairs. And, the other thing that I'm doing for myself is I'm learning something new. So I'm an acupuncturist and I do body work and healing on other people for a living. And, right now I just need to focus on healing myself, but I also need to figure out a stream of income. I am not independently wealthy, and it's difficult financially. So I'm learning something new so that once I get to that 3-month point, or when I can use my arm a little better, that I can actually be earning some more income. Anyways, it's good to expand your mind, and I'm keeping the mind busy during these times so that I'm not just kind of zoning out on Netflix or Amazon Prime or whatever it is, but also taking, I'm taking some downtime too and letting my brain relax. But, think about something you might want to learn, do an online course or, read books or whatever it is that you enjoy, but just prepare yourself for, a period of time when you're really not going to be necessarily that productive and make the most of it. All right, so that's all for today. I hope that you found this useful and beneficial, and hopefully you have the best outcome possible. Happy healing and enjoy the process.